Hey, this is Christopher South, and on this week's episode of how ANP2 relates to the real world, we're going to be talking a little bit about the lymphatic system. I know for me personally, it's not one of my things I get really excited about is the lymphatic system because it's something that working in an emergency department, I don't really think about all that often. However, it is very, very important. So let's look at a couple of the functions of the lymphatic system, what it does, and how that relates over into some of your medical practice when you guys get out of school and start practicing on your own. One of the things that the lymphatic system does is it grabs that extra fluid and brings it back into the bloodstream and gets it taken out and moved around and everything. This is really important when we're talking about the shifting of fluid. If you have a problem with your lymphatic system, all right, that fluid is going to build up and can result in a condition called lymphedema. All right, there's lots of different causes of lymphedema. Can be one of the things we see it is patients who have excessive weight and they come in with lymphedema. If you've ever seen My 600-Pound Life, you see the people with the big legs and stuff. That's lymphedema. But one of the other things that can cause lymphedema is burn patients. So if we have a patient who, let's say, has a pretty severe burn, they've got a full thickness burn, maybe for an example here, we've got a patient who has a circumferential burn of the arm. All right, so that means that it's all the way around the arm. All right, once that tissue has been damaged, all right, and the lymph, all right, is because it's going to rush in the healing process. We have swelling happens, and when that happens, if the lymph system in that arm is damaged, it can cause excessive swelling that the body is not able to reabsorb and get rid of. And that damage, that swelling and everything can cause what's called a compression injury. And that compression injury can squeeze everything. You can have a loss of function of the limb. And in severe cases, when we have like a circumferential burn, they do what's called an escharotomy, is actually where they relieve pressure, is where they make an incision around that allows that tissue to swell. And so one of the things that they do to treat like burn patients with that is, of course, massage when it's recommended. But a lot of times they make them wear compression garments, which actually helps to allow the fluid to drain the way it's supposed to. So one of the other very important functions of our lymphatic system is the is how it works in the way your body um, deals with invaders. All right, so in the lymph nodes and everything, this is where white blood cells are, and it filters through all the fluid that's in the lymphatic system and everything, and it sends out those white blood cells, macrophages, to go around and take care of all of those things that kind of get into your body and to invade and cause damage in your body. And so kind of think about that lymphatic system, with that as like a filter system, but it's got little checkpoints. Just like if you were driving through Europe, as you go from country to country, you have to stop at each little border and everything. So those are kind of like the border guards, making sure that everything's okay, that nothing gets through. And for patients who come into the emergency department, if we suspect that they may have an infection, let's say for an example, they come in and say, I've been experiencing malaise, I don't feel very good, I've got a sore throat and everything. One of the things that the physician is going to do is going to palpate the lymph nodes. And so they start kind of feeling around on their neck, and those lymph nodes, they feel like little marbles when they're swollen that are in there, and that lets that physician know that there is an overproduction of white blood cells that are trying to fight off an infection. Very, very important. But we can also see this and on the other end with patients who have cancer and different things of that nature. Now, the lymphatic system also has kind of another important role, which is the solubility of lipids and everything. We don't really look at that too much. But one of the two biggest things that we really look at in the emergency department, at least for where I work, is that we do check lymph nodes. We're looking for infection and everything, and we do see quite a number of patients who come in with lymphedema who need to have that treated. So I hope this kind of gives you a little bit of an idea about what are some of the things we're looking for as far as the lymphatic system goes in the emergency department. I hope that you guys have a great day, and I'm looking forward to the next lesson next week. Have a wonderful day, guys. Thank you.